Hey, everybody, and welcome to the Dr. Mom Show. It is Dr. D, mom of three, your host. I am super duper excited that you are joining me today. And of course, this week is even extra special because this week is also Valentine's Day. Whoop, whoop. Who doesn't love a little Valentine's Day? I love Valentine's Day. I love love. Love is good. And of course, this week I'm excited because I am focusing in on a woman's heart and what that means. And I'll get into that a little soon. Of course, before we jump into the show, don't forget that the Dr. Mom Show is an informational medical resource that does not take the place of your physician or your child's physician. So definitely seek your medical advice and your child's medical advice and treatment plans from your own physician or your child's physician. So again, of course, today, like I said, I am talking about a woman's heart matters. And you may say, what does that mean? Well, it means a lot today because, first of all, February is our month of love. And also this month, I'm focusing in on matters of the heart. And this month also, if you did not know, is National Heart Disease Awareness Month. So we always want to make sure our heart is functioning well because it's very, very important. And it's okay. People say people wear their hearts on their sleeves. And if you don't know what that means that you are a little bit more emotional or sensitive. And you know what? It's okay to wear your heart on your sleeve because studies have shown that people will hold their emotions in and keep those emotions in, whether that's anger, bitterness, frustration, whatever that is, have a harder time, have a higher chance of even having heart disease because you're putting more stress on yourself and not letting it out. So definitely it's okay to wear that heart on your sleeve. And again, that does not mean that to go around crying or yelling at people. No, that just means having somebody to talk to and being able to talk about your feelings, talk about your emotions if you're upset about something. So for example, again, in February, of course, we are focused on couples because we're talking about love here. So if you're upset at your spouse or something, it's so important to have that communication that you can go and tell them and feel comfortable in saying, hey, I'm upset or I'm angry or whatever you did hurt me, and have that conversation. You'll see if that communication is open, it's so much better than yelling at each other and somebody saying something that they should not have said. So we're going to jump right into today. Again, ladies and gentlemen, a woman's heart matters. So definitely make sure you love the woman that you are with. And don't forget your mamas. Don't forget your sisters. Don't forget your grandmothers. Of course, don't forget your daughters. But today, again, I'm focusing in on our medical hearts and the medical health of our hearts. So as I alluded to before, I am going to talk more about heart disease, but focus in on women's heart health today, which is so important because if you did not know this, heart disease is the number one cause. It is the leading cause of death of women in the United States. Did you hear me? It's the leading cause of death. You've heard me talk about breast cancer, which is insane, but heart disease is the leading cause of death in women. And according to, I'm going to drop some statistics on you today. But according to the CDC or the Centers for Disease Control, it is the leading cause, heart disease is the leading cause of death for African American and Caucasian women. So with that, I just want to start off and say that heart disease does not discriminate. It doesn't matter what color, what race, what background, what creed, what it is going to get you. If you do not take the precautions and live a healthy lifestyle, it is going to get you because it doesn't care about, again, the color of your skin or your background. So ladies, or if you're a guy listening to the show today, please share it with a lady that you may know so that they can be more diligent about their living and their lifestyle. And, sometimes people just don't know. Again, I'm a firm believer that people don't know until they know. So if somebody did not know that heart disease was the leading cause of death for women, they don't know. So they don't know how important it is to make sure our lifestyles fit that bill of having a heart healthy life and a heart healthy diet, as we say. And again, of course, Dr. D loves dropping the statistics on you So today, again, just from the CDC, again, the Centers for Disease Control, it says that 1 in every 5 female deaths is due to heart disease. So the next time you go outside, I want you to look down your street, and I'm sure there's 5 houses around you. And I'm pretty sure that there is at least one female that lives in each home. And then think to yourself, out of these 5 homes, including yours, so 4 other homes and then yours, one of these females, and you're in there, is going to die from heart disease. But today, because you are going to get some gems and knowledge that I'm going to drop on you about heart disease, you are going to change your lifestyle. Okay, you guys hear this? And listen to this fact from the CDC. It says about 1 in 16 women age 20, that's young, right? And older, so that's approximately a little over 6%, have coronary heart disease. And again, that's the most common cause of heart disease. Isn't that crazy? So as early as the age of 20, and you may be like, what's coronary artery disease? So coronary artery disease is when we have plaque buildup or fat buildup, a fatty buildup, or, you know, we talk about our cholesterol. So this is that high cholesterol, which again goes back to diet. And of course, I have to say genetics does play a role. So of course, if you have a genetic predisposition or a family history of high cholesterol or heart disease or coronary artery disease, of course, you're a little bit more susceptible, but that does not mean that it is going to happen to you. And that's what you need to understand, that it does not mean that it is going to happen to you. You can change that path and that direction by taking, again, those heart healthy steps in order not to be one of the statistics. So I'm so excited to talk to you about this today. Again, don't forget to share this, share the podcast, share the video as we talk about this topic. So let's go into it. So what are some symptoms that we can see of heart disease? How are you going to know that you have heart disease? So when we talk about heart disease, we're talking about a heart attack, essentially. And there can be different causes of heart disease, like I alluded to, again, coronary artery disease. So again, that's that plaque buildup. So it leads up to that heart attack. So very, very important that this is something, because the majority of people, sometimes we see it very random, but the majority of people do not have heart attacks just out of the blue. Usually you have to have high cholesterol. Of course, smokers are at higher risk. People who abuse cocaine, we see it can cause almost like spasms of the arteries. If you're listening and you know somebody who abuses drugs, especially cocaine, that can induce a heart attack. So for example, if we get a young person who comes into the emergency room and having symptoms of a heart attack, it's very likely that they abuse drugs, and cocaine is one of those drugs that can cause a heart attack. So what happens when somebody's having symptoms consistent with heart disease? So women aren't as textbook, but of course they can present with textbook symptoms of a heart attack. So of course, normally people can have chest pain. So of course, a left-sided chest pain is probably one of the most common things. And this pain can go down into, usually it's a left arm, and it can also go up into the neck. So if we see that that pain is radiating. Also, patients can start having numbness and tingling. So feel numbness and tingling going down that left arm can be described. A lot of times people can even start having pain where the pain radiates from the chest into their back or into their abdomen also. And a lot of times, because again, I'm going to reiterate that women do not present like men. Usually that textbook presentation of heart disease is not the same. So a lot of times women can present as if they're having severe reflux. So even with some nausea, some vomiting, and just with that, what we call, I'm going to sit up here so you can see, if you're looking just right under your sternum, right under your rib cage, we call that your epigastric area. So right in that area, they have pain, and it may not necessarily be left-sided chest pain. It may be right in the middle of their chest that they're having more discomfort. And again, it may seem like it's reflux, but it's really not. That's why it's so, so important to tell your doctor what your history is. So they know your family history. They know other history of diseases such as diabetes, high cholesterol, high blood pressure. So that's why it's so important. So remember, when a patient presents, people can also have dizziness. They can also get shortness of breath. Patients can get sweaty and all of a sudden start getting what we call palpitations, or your heart starts racing. A lot of times people, when they have heart disease, can even go into what we call arrhythmias, where they go into a regular rhythm of their hearts, and that can feel like they're having a heart attack or palpitations, like I talked about. So important. Now, again, another thing, kind of like coronary artery disease, is heart failure. Now, heart failure, there's two types of heart failure. There's one where the function of the heart itself is sustained, so it's kept. So if you've ever had an ultrasound of your heart, we call that an echo. We look at something called an ejection fraction. And normally the ejection fraction is about 65 if somebody is super athletic. So Olympians, of course, again, remember the heart is a muscle. So people who work out a lot and train a lot, that muscle is working much better compared to somebody who's just doing maybe regular exercise and just regular daily activity. So 65 is what's normal. Some like Olympians and athletes may have like 75, which they're just above average there. But 65 is what we're looking for. Now, with one type of heart failure, people maintain that pump function, that ejection fraction that I just talked about. But then in another type of heart failure, people don't maintain that. That number starts going lower and lower. So they may have an ejection fraction of like 45, that the function of their heart, it's functioning at 45% at how it's pumping. And what happens is when there's issues with the heart pumping, people start retaining fluid. So you can start getting fluid in the lungs. And on chest x-ray, a lot of times we see there are people, the way they breathe, we can hear that fluid is in their lungs when we listen to them. And then sometimes people can't lay down. They have to, people will present and say, I get short of breath when I lay down flat. They have to lay up, propped up on more than their usual amount of pillows, or they have to be up in a recliner in order to sleep so they can breathe. Another thing with that fluid retention, they'll start retaining fluid in their legs. And of course, as that fluid retention gets more and more, that fluid retention moves up. So first they may have like swelling in their ankles, and all of a sudden it's moving up to like their shins and their calves. All of a sudden, it's moving up to their upper thighs. All of a sudden it's like in their back that you can see what we call sacral, your sacrum, that's your lower back. We can see edema, and that's fluid retention all the way up into the sacrum. So if your heart isn't functioning well, you can see that there's so many repercussions that can happen in all those things. So again, coronary artery disease, that plaque buildup with high cholesterol, heart failure, and arrhythmias. These are just some things that can lead to a faster endpoint of heart disease. So again, that's why it's so important that you know what your heart function is, what your cholesterol level is. You really know what risk factors there are, such as family history, or how you're living your life. Like if you're smoking, or if you're eating really fatty foods that aren't good for you, where that risk is for you. So these are just some ways, some risk factors. And then of course, the presentation. I talked about the chest pain and how you feel. So ladies out there, please, if you're having any abnormal sensation, definitely get checked out. And of course, you guys have heard me say this before, it's so important for you to get your physical checkup. And especially now, listen, now there's telemedicine. The majority of insurances are paying for virtual visits. So even though you do a physical virtually, you can still get your blood work and stuff done and figure out what's going on. To keep track of that, it's so important to keep track of that and get seen at least once a year. If you think that you're healthy overall, you need to get checked out. So what are some risk factors? So again, I talked about your family history being a risk factor. And the CDC, again, my people, Centers for Disease Control, had an astounding statistic that about half of all people in the United States, approximately 47%, so that's about half of the people, have at least one of the risk factors for heart disease. Isn't that crazy? So that's like, if you're married right now, we're talking about Valentine's. If you're married, you're obviously a couple. So like one of you have a risk factor for heart disease. That is crazy, right? So the biggest ones are high blood pressure, and then smoking, and then your cholesterol. You heard me talk about all three of those before. So those are probably three of the biggest ones. But some other things that are on that risk factor list is if you have diabetes, you're at increased risk. Of course, you heard me talk about family history, physical inactivity. If you are not exercising and keeping your body in shape, that increases your risk. If you are not eating well, again, you heard me talk about that heart healthy diet, that increases your risk. So definitely make sure that you are talking to your physician and you are finding out that you are doing the right things. And, you know, it's not that difficult. We recommend that you exercise for about 30 minutes 5 times a week. And if you can't, I tell even my patients, if you're going from 0 to 2 times or 3 times a week, start off with that. But if you already work out, try to work out a little bit more. I know it's hard. Everybody's schedule is like to the T that you're trying to squeeze every minute of the day, because I know that's how my schedule is. But if you don't have your health, if your heart isn't working, if you have heart disease, I mean, how are you going to live a long, healthy life? You're not. So that's why it's important to take that 30 minutes a day for yourself. Let that be your time that you take time to exercise and work out and to keep your body and your heart healthy. It's so important. And then when it comes to food, of course, you really want to watch those fatty, greasy, oily, fried foods. You want to do things that are more baked, broiled, grilled, of course, more vegetables and fruits. Watch out for carbs and starches. And again, it's not that you can't eat those things. It's just you really want to eat those in moderation. If you're eating out more than once a week, stop that. I totally get it. We're all busy. It's hard. But you know what? You have enough time at least once a week to make 2 or 3 meals, and then just keep that so that on days, put it in your fridge, put it in your freezer, so that days that when you're super duper busy and you can't cook, you already have something that you made. Have a leftover night. You know, a lot of people they like throw out their food after they're done. No, keep them leftovers, leftover night. Way better than getting fast food or getting food from a restaurant. Way better. Okay, so please, please, please take care of yourself. So what else can you do? Again, know your blood pressure, get checked out. I talk about hypertension. I talked about how it increases your risk. So know what your blood pressure is. Know it. Ideally, we want your blood pressure to be less than that top number 140s, bottom number less than 90s. Know if your blood pressure is normal or not normal. Just so you know, pre-hypertension 130s over 80s. Some people may hang out there, so definitely talk to your physician, because depending on what your other risk factors are, you may need to be on medicine. So for example, if you're diabetic, you may need to be on medicine because your risk for heart disease is already higher than somebody who doesn't have elevated blood pressure. Again, going back to diabetes, so important. You know, we call diabetes slow killer, and that is because it increases the risk of heart attack, stroke, eye issues, vascular issues with your blood vessels, nerve issues with neuropathy. But it's something that's slow. Everybody's scared of a heart attack and stroke, but you should be scared of things like blood pressure, cholesterol, diabetes, because these things lead up, when they're not controlled, to things like a stroke or a heart attack. And again, today we are focusing in on heart disease. So important. If you're a smoker, no matter what, whether it's a couple cigarettes a day, a pack a day, or 2 packs per day, you need to get off of it. Get off of it. Known that it increases your blood pressure. Look right there. You have one risk factor of smoking, and look, you're getting yourself another risk factor by increasing your blood pressure with smoking. So important to try and quit smoking. Talk to your doctor. You know, some people are able to quit smoking cold turkey. They're like, I'm done. That's it. Some people need help. There's things that you can do in order to get help to get down and cut down on your smoking. Get the help you need and do it, because it is a risk factor. Going back to cholesterol. So of course, there's different types of cholesterol. We have our total cholesterol. We have our bad cholesterol, which is your LDL. That's the one that really matters. L, I tell patients, stands for low. So you remember that's the one you want as low as possible. There is a good cholesterol, that's your HDL. And I say H stands for high, because that's the one that you want as high as possible, because that has been shown, a high HDL has been shown to be protective for our heart and against heart disease. But if we have a high LDL, that's bad for our heart. And even in diabetics, we have stricter parameters for diabetics, again, because your risk factor is higher. So we want diabetics to have even a lower bad cholesterol than people who don't have risk factors. So see why it's so important. Is it coming together for you? I hope it is. It just shows you that these risk factors, if you take care of all these risk factors and knock them out one by one, overall, the big picture is that you will decrease your overall risk of heart disease itself. Again, going back to food, make healthy choices. Make healthy choices. Another part is alcohol. It's okay to have a drink here and there. Of course, you can have a drink daily. That's still not considered alcohol abuse. So some people like to have a glass of wine with their meal. It's totally okay at this point. But definitely do not binge drink or overdrink or get like a 6-pack of beer and then just drink that every night. No. Increases your risk of heart disease. And finally, your stress level. Make time for yourself. Make time for yourself. We talked about exercising, making that time. And I talked about emotions at the beginning of the show, that making sure that you have somebody or you're able to talk about emotions and let them out. Let it out. It is known that stress can induce a heart attack. And you know how? Part of it is because stress increases your blood pressure. If you're diabetic, stress increases your sugar. We know this because if we have somebody who is already diabetic and they get admitted to the ICU or the hospital, their sugars go up because their body is under stress. It's sick. So if you have stress already, here we go, your blood pressure goes up, your sugars go up, you're stressed out, your heart rate is going up, so your heart has to work harder to keep up with you. So of course, I hope this is making sense and how that increases your risk of heart disease. So definitely make sure these tips that I've given you, these are simple. And I'm not saying, oh, go like as soon as the show's done, like, oh, you're gonna go make all these changes. No, I know that's not realistic. One thing at a time. Like even my patients who are smokers, I tell them, don't all of a sudden go on this big diet when you're trying to quit smoking. No, do one thing at a time, but each little step you make will make a big difference for your heart health. So be careful, be kind to your body, be kind to your heart, especially my women out there, because a woman's heart matters. So if you have a special lady out there, make sure that you're taking good care of her. Make sure that you share this podcast and this show with her so she knows how important her heart is, not only physically, but also emotionally, how important her heart is. And especially during this time of the month, as we hit on Valentine's Day, it's so important to know how we live and what we do and how we eat and how we think and our emotions and our feelings, how it affects our heart. It's so important. And again, the biggest takeaway I want you to remember today is that heart disease is the leading cause of death in women in the United States, and it does not discriminate. That's for both African American and Caucasian women. So remember that. Make sure you keep that and know it. And it's so important. So I hope you enjoyed this show today. I hope you learned so much more about heart disease and how it affects women. And don't forget to check out the Dr. Mom Show. If you missed any previous episodes, you want to check out all the guests I have had on. We've been doing such a good job with everything, and we just want you to learn so much and get so many gems from this show. So I'm so excited. So make sure you check out the past episodes if you've missed it, especially this month, because again, we are talking about matters of the heart. And especially today, we're talking about how a woman's heart matters, which you should realize right now. Of course, happy Valentine's Day. Have a fantastic Valentine's Day. Don't forget to check out DrDeleneMushalak.com. You can get yourself some freebies on there. So I got my immunity guide up there. If you're looking to make changes to your diet, to do something, I got my detox plan going right now. I also have my clean eating program. That's a group coaching program going on right now. That's filled currently. The new class starts in March. So if you want to go ahead and sign up for that, you can. I have so much fun there because people not only learn from me, but I love the group setting because they learn from each other. And then people have accountability partners. You know that it's so important to have accountability partners. Of course, if you're looking to turn your vision into legacy and thinking about writing a book, we would love to publish your book at Alea Publishing. Hit us up. Just go to aleapublishingllc.com for that. And then, of course, don't forget that you are beautiful, you are strong, you are amazing, and you can do anything you put your mind to because you are a superhero. And have faith over fear, and God bless. And of course, like Dr. Mom, I always say, don't forget to wash your hands, kiss your kids, love your family, and say your prayers good night. God bless everybody. Bye-bye. Happy Valentine's Day.